Before you start testing, instruct the patient to turn off all their electronic devices in order to minimize noise. Now look in your patient's ear to ensure no excess cerumen is present.
10.
Clean the patient's skin on the high and low forehead and behind each ear on the mastoid. Wipe off any excess abrasive gel. Place your 4 electrodes. And connect the ground, vertex, and non-test ear electrodes. You will be using a TM trode for the test ear. When using a TM trode, you have to use an ECochG cable. Place the red cable in the plug corresponding to the test ear. Place the green cable in the ground plug, and insert the black ground cable in the green plug. Insert the TM trode gently on the eardrum, and afterwards insert the transducer. Now test the impedance. Impedances below 5 kiloohm are acceptable. However, impedances up to and above 20 kiloohm on the TM trode are normal. During the test, the patient should relax with their eyes closed and even go to sleep if possible, as this will improve results.